Hi, my name is Gillian Morgan,
I'm Josh Harness.
And my name is Aaron Laws.
and this is our presentation on leukemia and Ponatinib hydrochloride. Leukemia is found in bone marrow and the blood. It affects white blood cells by causing abnormal white blood cells to rapidly reproduce. Abnormal cells can't fight infection and impair the bone marrow's ability to produce red blood cells and platelets. It can be either acute or chronic. Chronic leukemia progresses slower than acute, which needs urgent treatment. Leukemia can also be lymphocytic or myelogenous. Lymphocytic leukemia has abnormal cell growth in the marrow cells that become lymphocytes, and myelogenous leukemia has abnormal cell growth in the marrow cells that become red blood cells, white blood cells, and platelets. Mutations of TP53 are used for classification of certain leukemias. It is associated with a complex karyotype and worse overall survival, as well as disease-free survival. And intact P53 alleles have decreased P53 activity. It also affects DNA repair, the cell cycle, apoptosis, and metabolism. P53 affects that. Receptor tyrosine kinases regulate cell growth, repair, and tissue regeneration. Ponatinib inhibits the receptor tyrosine kinases, like BCR, ABL tyrosine kinase, and isoforms that are mutated to resist existing target therapies.
All right, so now we're going to talk about the epidemiology of leukemia. So the health concern is that leukemia involves white blood cells, and it's a potent infection fighter. So when you have leukemia, your bone marrow produces a bunch of different white blood cells, and that leads to them not functioning properly. So that's how leukemia happens and spreads. The current incidence, which is new cases for 2022, it's estimated to be 60,650. For males, it's 35,810, and for women, it is 24,840. So that adds up to be the 60,650. And then between 2014 and 2018, the incidence rate was 14.2. Current mortality for 2022, it's estimated to be 24,000, 14,020 for males, and for women, it's 9,980. Between 2015 and 2019, the mortality rate was 6.1. All right, so I looked up the stats for North Carolina, since that's where we live and that's where we go to school. And the projected incidence for 2022 is 2,120, and that ranks sixth in the United States for new cases. And the projected mortality rate is 800, and that ranks ninth in the United States. Leukemia is ranked 11th this year for the most common types of cancer. I think the most common was breast cancer. I think that was the first one. But China and US rank 1 and 2 for men who get leukemia. And then China and India rank 1 and 2 for women as of 2018. I think for women, the United States was ranked 3rd since 2018. All right, so this chart, it shows the rate of new cases for men and women and also different races. Also, leukemia is more common in males and females. But if you look at the chart, the non-Hispanic whites and non-Hispanic blacks tend to have a higher rate of new cases. And also Hispanics and white people are more prone to leukemia, and black people have the lowest rate for a potential new case. I couldn't find why that's the case. I'm not sure. They couldn't find it either. Like there has been research done, but I find it really interesting that white people and Hispanic people have a higher chance of getting leukemia. All right, so why is leukemia more common in males? Some men who have leukemia have certain mutations that are located on the X chromosome, and that leads to damaging tumor suppressor genes, which activates the cancer. Another reason why is lifestyle choices. Men are more likely to get it than women because it's said men are more inactive, but as years go on, they expect women to be just as inactive as men. Also, smoking and alcohol consumption can increase the chances of men getting leukemia. And as I said before, in a few years, women will be right around the same average-wise when it comes to incidence and mortality, which is the rate of new cases and the rate of death. All right, so the known risk factor for the epidemiology of leukemia is people over the age of 65 are at a greater risk, especially white males over the age of 65. Now, there's no way they haven't found any way to prevent leukemia, but there are different ways you can limit your risk. As stated in the article that I do not see, I forgot to add it, I think, but it's on the sources page, I think. But the older you are, the higher risk you are. For example, if you're 70 years old and you smoke and are inactive, your risk goes up. If you're 70 and you don't smoke and you're active, your risk won't be as high, but you still will be at risk because you are over the age of 65. So this information is useful because it can help limit your chances of getting leukemia. Other ways is healthy body weight, eating healthy, staying away from radiation, not smoking, and stuff like that. The observational study focuses on Italian patients that I found, and it discusses how when you get older, the more likely leukemia becomes. The strength of age is huge because everyone gets older, so each day that you live, the risk goes up in some way. I love the quality of the findings because it talks about the multiple risk factors, not just age, but age is a big reason why. And clearly in the study, there were more older patients with leukemia compared to younger, and then there were more males with leukemia compared to females. All right. I suck at saying this. The efficacy of the targeted intervention is Ponatinib Hydrochloride, and it inhibits mutated and unmutated forms of that. It inhibits tyrosine kinases and tyrosine kinase receptor. It is orally and bioavailable multi-targeted receptor. The side effect profile is that it can cause many things, but some of the most common include rashes, abdominal pain, hypertension, and it usually causes cardiovascular events. Another side effect is peripheral neuropathy, and that means it affects the nerves. So numbness or tingling, and the intervention study on the next slide. It's a phase 2 trial, because the phase 3 trial is still ongoing. All right. So this is just the presentation of the intervention study. It's a phase 2 trial of acute lymphoblastic leukemia, and it's the combination of chemotherapy with a tyrosine kinase inhibitor. 76 patients were, with a median age of 47, were treated. They examined how well the chemotherapy with the Ponatinib Hydrochloride worked. The magnitude of the treatment is that it was highly effective. The outcome was that a few people sustained remissions, were newly diagnosed, and 78% of the patients remain alive. The overall survival rate is 81%, and 6 patients actually died in the complete response stage of the study. The risk-benefit analysis is that the risk of participating in this is that you'll know how this how leukemia works, and the benefit is you'll be able to see what works for some patients and what doesn't work for others. You can see potential risk factors and get more of an understanding as to why some people develop leukemia and how to treat it. It's expensive. The cost of the Ponatinib hydrochloride is around $19,000 to $20,000 for 30 tablets. So that makes it hard for some people to get because the price is so expensive, but it can be very useful, and it helps limit cancer cells from growing.
Okay. So sorry about any background noise. I have an AC going in the background, and I'm doing this at a Boy Scout camp. So so the main types of leukemia that are used for this are targeted chemotherapy is acute lymphoblastic leukemia, and it's separated into 2 main subtypes: the B-cell lymphoblastic leukemia / lymphoma, which is basically it begins in immature cells that would develop into B-cell lymphocytes, and then it would be mutated into leukemia versions. And this is of the lymphoblastic leukemia, it accounts for 75% of the total cases. The other subtype is T-cell, which is similar to B-cell, except for instead of it being a mutation of the B-cell lymphocytes, it's a mutation of the T-cell. And this makes up the other 25% of the cases. So these are the main 2 subgroups. Okay, so as far as prognosis, the RISE system is used for leukemia. So it has 4 different stages, or technically 5 if you include the 0. So stage 0, where there's high levels of white blood cells but no other physical symptoms. This would be when it would be the most hard to find when trying to get diagnosed or finding these symptoms, because this would be also whenever there would be other varying symptoms from high fever to unexpected weight loss to excessive sweating. So hard to find. And since stage 1 is very similar, and it's also could be hard to find and catch early, and same level, high levels of white blood cells, but then now there's large lymph nodes. Stage 2, patient will still have those high levels of white blood cells. They will then become anemic, and then he or she will also still have those enlarged lymph nodes. Then stage 3, same thing as stage 2. The only major difference is that at this point, due to the white blood cells and everything, an enlarged liver or spleen can occur. And then stage 4, same as I said, as stage 3, since it's getting worse and worse, except for it's overall have low platelets, high levels of white blood cells. So all of this is basically just shows how it can get very bad during the different stages, and catching it early is very important when trying to find leukemia cases and different stuff. So, but thankfully due to technology and the overall outlook and expected survival rate in most forms of leukemia is about the range of 60 to 65%, depending on the year. The most current is around that number of 60 to 65%. So thanks to this, though, we don't have to do as much hard therapies on the body when it comes to leukemia, and we don't have to do as many more difficult and risky surgeries such as bone marrow transplants as well. So as far as leukemia, when it spreads, it starts in the lymph nodes most likely, or depending on, but most commonly it starts in the lymph nodes, and from there it will enter the bloodstream and can travel into any of the organs such as, or different places like, so it'll get to the central nervous system. It'll then move to the lungs or the heart or the liver, and sometimes even the gums, spleen, kidneys, and many other places that are more unexpected and that are a lot rare. Those gums, spleens, kidneys are a lot rare compared to lungs, heart, liver. Those are the most common. But all of these can be very bad if leukemia has managed to spread that far. Okay. So when it comes to the treatment of acute lymphoblastic leukemia, it's separated into three main stages when we're using chemotherapy. There's induction, which is the main stage of the therapy. The goal of this stage is to basically achieve remission. And this basically means that there's no more leukemia cells found in the bone marrow samples or areas that appear to be affected. And the induction phase will finish once normal bone marrow cells return and the blood counts will become normal. And this is normally about during the first prolonged month of hospital stays, where there'll be a ton of doctor visits, a ton of different therapies, and just have to be careful during the stage because infections can occur that can be very life-threatening, especially with just a low immune system after leukemia and after treatment. So it just will take a lot of work. So, but then the next step is consolidation, which is also can be called intensification. And this one is normally more intense because it's very similar to the induction, but except for chemotherapy will of whatever the target drug. So for in our case, the Ponatinib Hydrochloride would be going. You would have multiple runs of the chemotherapy within a few months, and or however it was a safe limit. And with the phase, just goal is to reduce the number of leukemia cells in the body as much as possible. And at this phase, different chemotherapy drugs can be combined to help prevent the leukemia cells from developing resistances and a few other things. And the last one is maintenance, and this is basically just after induction and consolidation. The maintenance therapy protocol begins, and it's basically just again different uses of the select drugs and combinations, along with maybe steroids and some other stuff, and just being careful to try and get through this as safely as possible, since with the hard therapy drugs. So that is the three main protocols. So then talking about Ponatinib Hydrochloride, so it is used in patients who have the T3-151 mutation, or whose cancer cannot be treated with other tyrosine kinase inhibitors. And it basically acts as an inhibitor to start certain growth actions or starting of tumors, if it can, and just to basically prevent any sort of growth from happening overall. And it can be resisted to, like leukemia can grow to resist it, and it has been found to resist this type technically, which is why a combination of multiple drugs is used. And so how leukemia sort of creates this resistance is it's able to synthesize, basically recreate the anti-cancer drugs with glutathione, and it basically allows it to inactivate the drug and cause a resistance to it as well. So, okay. So with drug combinations, like I said earlier, this can be anything from acetaminophen to other chemotherapy drugs. And it basically, a lot of these are just used to reduce the side effects or increase effectiveness of the drug in multiple ways. So, okay, and it was created, Ponatinib Hydrochloride was created in order to prevent leukemia from growing and replicated within the lymph nodes and other parts of the body. And there's a ton of other kinase inhibitors that exist. This is just one that is specific more towards lymph nodes. So these are our sources. If you have any questions, feel free to reach out to us, and thank you so much for your time.